See, I knew, Senator Cassidy, that if we waited long enough, there would be an issue we would agree on. And obesity certainly is an epidemic. It's impacting diabetes and a host of other issues, and something this committee must and will deal with. There's an issue that we didn't touch upon today. I have raised my deep concerns that there are many millions of Americans who cannot afford the outrageous cost of prescription drugs in this country, and that is something that the NIH must deal with. But there's another issue that we didn't talk about, and that is that we look at the global situation. We look at developing countries and millions of people throughout the world who are struggling to feed their families. What we find is that many of the prescription drugs consumed are consumed in the developed world, that poor people around the world cannot afford the medicines they need. Medicines, by the way, which may cost a few cents to produce. They don't get it, and they die or they suffer. Let me get this. Here's that. Sorry. All right. Okay. Thanks. Last May, President Biden announced that the U.S. government would share some NIH-funded COVID patents with the World Health Organization to expand access in low and middle-income countries. If confirmed, will you build on this commitment and make sure that medicines developed with NIH dollars are accessible and affordable in low and middle-income countries? Will you ensure NIH-funded technology is shared with manufacturers in developing countries so that they can produce the medicines their people need at a price they can afford?
Senator, I can confirm that I share your concern. I share your passion for bringing life-giving care to not just the United States, but the world. And I will work with you on this issue.
All right. I would hope that you would appreciate that in some cases, these drugs cost a few pennies to manufacture, and yet they're not getting it to people for whom it might be life or death. That is something that you will pay attention to?
I will confirm that I will be very delighted to work with you on this issue. It is critically important.
Okay. Well, thank you very much, Dr. Bertagnolli, for being with us today. That concludes our hearing. As a reminder, the committee will have a markup next Wednesday, the 25th, on this nominee and a few others. For any senators who wish to ask additional questions, questions for the record will be due tomorrow, Thursday the 19th at 5 p.m. Committee stands adjourned.